And good morning to you. I'm James Wilcox. We are interrupting this morning to share with you a virtual news conference with medical professionals as well as community leaders. They're presenting a new campaign to curb the spread of COVID-19. They call it Do Right, Right Now. Douglas County Health Director Dr. Adipour, Nebraska Governor Pete Ricketts, and others are taking part in this virtual news conference. So let's listen in.
At the end of the presentations, you may either type your question in the Q&A or use the raise your hand feature at the bottom of your screen to be heard. This presentation will be recorded and a link will be sent to anyone who is interested. I want to start by thanking all of our partner organizations and media outlets for donating their time and resources and joining us in this unprecedented effort to deliver a positive and important message to all Nebraskans. Every one of our partners understands the importance of sharing this campaign with their subscribers, friends, families, and neighbors. A complete list of partners may be found on our website. I would also like to thank Vic Guttman and his team for their unwavering support and dedication to making this campaign a reality. Vic and his team have donated countless hours to create a campaign that will resonate with Nebraskans in an effort to put an end to this virus. This campaign could not have started at a more critical time. Douglas County and the entire state are seeing an extreme increase in COVID-19 cases. It is imperative that we educate the public on how to fight the spread of this potentially deadly disease. In order to fight this pandemic, the Douglas County Health Department and the Omaha Community Foundation have teamed up to support this unified campaign. As the campaign grew, leaders from outside of Douglas County were brought in to the conversation. And through a partnership with the Nebraska State Department of Education and Nebraska Children and Families Foundation, the campaign has expanded to serve the entire state of Nebraska. The Do Right, Right Now campaign is slated to last 6 to 9 months and will evolve and reinforce each community member's role and responsibility in helping reduce the spread of the virus. Key messages reinforce wearing a mask, washing your hands, and watching your distance. We will encourage the public to get flu shots and get a COVID test if they have symptoms or have a known exposure. We will also promote mental health services, so important at this time. Once a vaccine is available, the campaign will educate the public on its benefit and how to get it. These messages will be promoted in a positive and upbeat manner using current data and research. A website has been developed to provide campaign materials and links to resources. Visit dorightRightNow.org for more information on the campaign. What makes this effort truly unique is the generous support we have received from TV, radio, print, and outdoor media throughout the county and statewide. More than 45 partners have signed on to donate, add space, resources to make this campaign possible, and to ensure that every Nebraskan hears and understands the importance of taking these preventive measures. Our goal is to reduce the rate of new cases and hospitalization across the state. This can only be done when all Nebraskans choose to do right now, do right. I'm joined this morning by Dr. James Lawler. Dr. Lawler is the Director of Clinical and Biodefense Research, the National Strategic Research Institute. He serves on the faculty of the University of Nebraska Medical Center's Department of Internal Medicine. Dr. Lawler has field experience treating Ebola patients and serves as a subject matter expert in the training of Department of Defense medical personnel working with infectious patients. Dr. Lawler, please.
Thank you, Dr. Poor, and it's a pleasure to be able to address everybody today in these trying times. So I'm going to share my screen, and hopefully this will work. All right, can everyone see my screen? Adi, can you see my screen?
Yeah.
Great. So I was asked to talk about the current situation in Nebraska, and I think that's important, but I also think that we should talk a little bit about where we're going and how we change that course, which is obviously the purpose of the Do Right Now campaign. I think that there are certainly times when listening to doctors and scientists are not going to help you. If you are making your business plan for your small business, or you're mapping out your offensive strategy for Saturday's game, then that's probably a time not to listen to doctors and physicians. But I think when you're in the most impactful pandemic that the world has seen within the past 100 years, that probably is the time to listen to scientists and physicians. And this is what we're telling you. We are in the most dangerous time of this entire pandemic. You can see on the left, our case counts are dramatically higher than they were in the spring, and they continue to go up at an alarming pace. Our current hospitalizations are also at a dramatically higher rate than they were at the spring. We are approaching 1,000 hospitalized patients across the state. And you can see that our doubling time for both of those metrics is between 2 and 3 weeks. And so that means 2 to 3 weeks from now, unless we are able to dramatically change course, we will see roughly 2,000 patients requiring hospitalization across the state. Given that we only have about 3,200 staffed beds to provide critical care services and med-surg services for adults in the state, you can see that that is an unsustainable proposition, trying to manage that number of cases. I can tell you that I've been in mass casualty situations in combat zones in Afghanistan. I've been in Ebola treatment centers in very austere conditions, and I have never frightened about the status of a health system as I am about the status of our health system in Nebraska right now. So what does it mean when I say that we have case counts as high as we do? I mentioned on the last slide that we have well over 100 cases per 100,000 per day occurring across the state, much higher in many counties. If you look at that rate for Douglas County, what that means is if you have an event size with 10 people, there's a 43% chance that somebody within that group is actively infected and shedding virus and poses a risk to others. This is why we emphasize eliminating gatherings of over 10 people because of the risk involved. We know that all of these interventions that we talk about are imperfect, and that's okay, right? So wearing a face mask is not a perfect solution. It does not prevent all transmission in all cases. Washing your hands and using good hand hygiene, eliminating large gatherings, none of these are perfect solutions, but when you layer them together like slices of Swiss cheese, all of a sudden they create a relatively impermeable barrier. But the key is combining all of these efforts and doing them consistently across society. And that's why we as doctors and scientists have been advocating for these measures to be put in place formally across the state. And the reason why we've asked for mandates is very simple, and it's because they work. We know that when mandates are issued and requirements come down from a state or local level, that people's compliance goes up considerably. This is just human nature, and it's been shown, I think, definitively and conclusively in studies that have looked at compliance for things like seatbelts, but also for face mask wearing, as you can see here in a study that was done by a group of economists from Goldman Sachs. This increase in face mask compliance in the states that they analyzed resulted in a reduction in cases and a reduction in fatalities. So that's why we have been, I think, relatively consistent in our support for those types of interventions. So what does this mean in terms of our future and our trajectory? So you've seen the projections, or at least the data that exists now for our case and hospitalization curves, and heard the projection that in 2 to 3 weeks we'll be at double that. Well, that means that we're now getting into the territory of North and South Dakota. So I scoured a few media sites last night to just look at stories that have recently come out of those two states. They're about 2 to 3 weeks ahead of us in their epidemic curve. So again, in that doubling period, when we'll get twice as many hospitalizations, this is what we're going to encounter. So an unchecked epidemic and approaching this idea of what people think is achievable as herd immunity doesn't just look like statistics and curves on a chart. This is what it looks like. It is unmeasurable, and I think for many people will be surprisingly high levels of suffering among families and communities within Nebraska. And people talk about that idea of being able to achieve herd immunity as a strategy for riding out this pandemic. Well, this is what that would mean in Nebraska. Over 7,000 deaths. If we think that herd immunity is achievable, potentially at 70% community attack rate, which is, I think, a conservative estimate based on our current understanding of the epidemiology, that's roughly 1.4 million cases in Nebraska. And if we look at a 0.5% mortality rate, infection fatality rate, which is probably accurate, and it does mean that 99.5% of people won't die, but it also means that 0.5% will. And if you have a 1.4 million infections, that's a huge number. That's almost 10 times what we've seen already. So this is what we're staring down if we do not immediately change our trajectory and implement those layers of Swiss cheese and non-pharmaceutical interventions that I discussed. Thank you, Adi.
And now we'll have Dr. Brunner.
All right, thank you. I do not have a presentation like Dr. Lawler did, but I will tell you our situation out here in the Panhandle very much mirrors what he showed for the state. We have found a significant exponential rise in the last few weeks. Today hitting more critical timing where we're taking out our outpatient things and saving staff for inpatient things. We have looked to our city councils and our county leaders to help us with things such as mask mandates, as well as campaigns to, as that Swiss cheese model showed with Dr. Lawler, other protections for our populations. We are looking forward to our the vaccine that may be coming, as well as the immunoglobulin therapy that is coming across the state. But we have a stubborn population, and so doing the right thing right now is exactly what our population would need.
Thank you, Dr. Brunner. And now we'll have Governor Pete Ricketts and First Lady Suzanne Shore.
Great, thank you very much. And I want to say thank you to all the community partners who are putting together this Do Right Now campaign to get the message out with regard to the things that we need to do to slow down the spread of the virus. This is something that will dovetail really well with what we're doing already at the state of Nebraska and our communications campaign that has been leveraging radio PSAs and digital campaign. And this campaign will work together with that to be able to get the message out about how we as Nebraskans need to all step up and take care of each other. And that's something that, Suzanne and I are experiencing this firsthand right now as we're quarantining here at home. And we need to make sure that we're all following those rules. So if you've been exposed, you need to be able to quarantine for 14 days. You can't test out of that. You've got to be able to stay home to see if those symptoms develop so you don't infect somebody else. If you're sick, you need to stay home in general. Get tested to make sure you don't have coronavirus, but any symptoms, make sure you're staying home so you don't go out. We got to make sure we continue to follow the rules with regard to wearing a mask, going to the store once a week, going by yourself, washing your hands often, all the different tools that we have that Dr. Lawler described as the Swiss cheese to be able to slow down the spread of the virus. And that's what this communication campaign will do. Really, Nebraskans have always stepped up to take care of each other in times of need. We saw this last year with the flooding, and this year we need to step up again right now to get back to the great habits we had earlier this spring when we slowed down the spread of the virus. We need to start practicing all those things again right now to be able to slow down the spread of the virus and make sure we preserve that hospital capacity. So I want to thank the Department of Education, Douglas County Health Department, and the Nebraska Children and Families Foundation for their work to be able to help spread the message and make sure that all Nebraskans understand what they can do to take personal responsibility to step up and make sure we slow down this campaign or slow down this virus by doing right. So thank you again to everybody who's been a part of this. And again, Nebraskans, it's time for us to all do the right thing, do it right now. And just one further message I'd like to add is please allow a little space for grace along with that we need to make sure that everybody is going through a tough time, that we understand that, and we're all a little bit more forgiving with our neighbors. And with that, I'm going to go ahead and turn over to Chris Rogers, who is the president of the Douglas County Board of Health.
Thank you, Governor and Suzanne. As the president of the Douglas County Board of Health, I'm here to follow up on what Dr. Poore and Governor Ricketts have emphasized today. It's imperative that everyone do their part to end the spread of the virus. However, I want to take a moment to talk and to communicate to communities of color in Nebraska. Communities of color are structurally at a higher risk of likely being infected and dying from the virus. Across the country, African Americans are dying at a higher rate than any other group. Communities of color tend to live in more crowded, multi-generational households, not to mention the increased instances of underlying medical conditions that often go untreated. Those working in essential roles are less likely to have paid leave and therefore have a difficult time self-isolating and can't afford to quarantine for 2 weeks. It's critical that all members of the community follow the recommendations of this campaign. Wear a mask, wash your hands, and maintain 6 feet of distance. I also ask that everyone please get a flu shot. The Do the Right Right Now campaign is translated in Spanish to reach as many Nebraskans as possible. And can I say that particularly here in Douglas County, with the high number of refugee populations, we have resources here to help those that may be of the Burmese or the Somali population, other refugee populations that need assistance in emphasizing this campaign. We can slow the spread of the virus, but we need everyone to help. This is not a black, white, or brown problem. This is a Nebraska problem.